COVID-19 cases rise around the world. I'm Steve Belair. Welcome to Breakthroughs. The world may be in the early stages of a pandemic as the coronavirus called SARS-CoV-2 spreads around the world, causing an illness called COVID-19. The number of newly reported cases in China is beginning to fall, and the number of infections outside of China is still relatively small, the Director General of the World Health Organization, WHO, noted. However, WHO is concerned about cases in the illnesses with no clear link to other infections. While the Director General of the WHO said that a reported reduction in new coronavirus cases in China was good news, he added that it's far too early to make predictions about this outbreak. This coronavirus is also far less deadly than others. Other outbreaks causing coronaviruses, SARS and MERS, had fatality rates of about 14% and 35% respectively. With current data, it seems that SARS-CoV-2 is fatal to around 2% of those infected. Around 80% of those infected have mild symptoms like a cough. Severe disease like pneumonia occurs in around 14% of the cases, and in about 5% of infected individuals, organ failure and septic shock can occur. Last Friday, only 31 new cases of SARS-CoV-2 infection occurred outside of Hubei province, seen as the epicenter of the epidemic. This is the lowest number reported since officials began collecting data in China last month. However, other findings may have the situation more complex. It took one man, a suspected, 27 days before his symptoms appeared, which is far longer than the 14-day incubation period that had been presumed. Another person in China that did not show any symptoms traveled 400 miles to visit family members that were then infected. Our biggest concern continues to be the potential for COVID-19 to spread in countries with weaker health systems. The agency has called for $675 million to aid the most vulnerable countries, with 13 African countries that have links to China seen as a priority. There are several other countries that are now struggling to stop the spread of the virus within their borders. In South Korea, alert levels have been raised as the number of confirmed cases continues to rise. More than 600 people are now infected and 6 have died there. The country is facing a grave turning point, said President Moon Jae-in. The next few days will be pivotal for our citizens. There are a growing number of cases in Italy as 12 towns have been shut down. Around 50,000 people cannot enter or leave a sealed area without special permission, and events like the Venice Carnival have been cancelled in an attempt to contain the outbreak. 2 deaths have already occurred, and there are more than 130 confirmed cases in the country, with 88 of them in a region called Lombardy. The contagiousness of this virus is very strong and pretty virulent, said the health chief of Lombardy. Italian authorities thought they traced the infection to patient 0, but the man tested negative. They also noted that the virus is not lethal, but it is dangerous to those who have pre-existing health conditions. Meanwhile, in Iran, the government warned the coronavirus may now be in all cities. 14 provinces have closed schools, universities, and cultural centers starting today. The director of the National Institute of Allergy and Infectious Diseases, Anthony Fauci, said that this outbreak might now be at the brink of a total pandemic. Whew. I'll leave a link in the description to the full article, and as usual, please like, share, subscribe, and take care.